I was fortunate enough to publish the first study that looked at the use of TNF inhibitors for psoriasis and the reduction of MI risk. So this was a study that came out in 2012. We had about 9,000 patients total in the study from 2004 to 2010. We had three groups: TNF inhibitor use, oral therapy and phototherapy, and topical therapy, which is the reference group. After adjusting for all risk factors, we found that patients on a TNF inhibitor had a 50% reduction of MI development. Interestingly, we also found that those on oral therapy or phototherapy also had a reduction of risk as well. There was another study from Denmark that looked at similar results with my study. They looked at heart attacks, stroke, and cardiovascular death. And so they had 7,000 patients with psoriasis in their study, and they divided them into 5 groups: biologics, methotrexate, retinoids, cyclosporine, and other therapies, which included phototherapy and topical therapy. So in their study, after adjusting for all risk factors, they found that those in methotrexate had a significant reduction of MACE. They looked at biologics and they found that there was a reduction, but it was not significant. When they broke it down further, versus when they looked at TNF inhibitors versus ustekinumab, they found that those on TNF inhibitors had a reduction of MACE, but not necessarily with ustekinumab. So if we want to believe that there may be a reduction of cardiovascular disease with TNF inhibitors, what's the mechanism? One theory is that it may reduce systemic inflammation. Dr. Strober had 2 nice studies where they showed that patients on a TNF inhibitor had reductions of CRP, which is often considered a marker for cardiovascular disease. I also published a study in JAD just 2 weeks ago looking at something similar. We had patients with TNF inhibitor plus methotrexate versus those on methotrexate alone. We found that those on the combination therapy had a reduction of CRP compared to their baseline levels. Those in the methotrexate group did not have a reduction. Patients with psoriasis also have dysfunction in HDL. As you know, HDL is used by the body to clear bad cholesterol. A study looked at 15 patients with psoriasis compared to 15 patients without psoriasis. They found that patients with psoriasis had dysfunction in HDL function, but there was no difference in HDL levels. After treating the patients with psoriasis therapies, they found that HDL levels were the same, but HDL function improved. They did not actually look at the type of psoriasis therapy, so it'd be interesting to see which therapy is the best in improving HDL function. So it's too early to say right now whether TNF inhibitors can reduce, in fact, cardiovascular endpoints, but I think there's some suggestion that this could be the case, and there'll be some prospective studies done by Dr. Gelfand that will look at this further. He has a so-called VIP study looking at patients on adalimumab versus phototherapy versus placebo. And so this is going to be a 1-year study. They're going to follow them and check biomarkers like CRP. They're going to check the PET CT scan. They're going to look at vascular inflammation, and they're going to see whether adalimumab can reduce vascular inflammation. They feel that that will probably be the case, and things like phototherapy probably will not reduce vascular inflammation. So all these things will slowly come to the conclusion that to see whether treatment of psoriasis aggressively may reduce cardiovascular endpoints. It's a very exciting time in psoriasis research at this point.